What should I ask my doctor if I'm low-carb, keto, or carnivore in 2026? If your brain goes blank the second that white coat walks in, this video is your script. By the end, you'll have a simple one-page checklist, which labs to request, how to say I eat differently without starting a war, and how to make sure labs, side effects, and weight loss goals get covered in a 15-minute visit. If you're new to my channel, hi, I'm Dr. Tony Hampton, board certified in family and obesity medicine with a master's in nutrition and functional medicine. And I help people use low-carb, keto, and carnivore to heal their metabolic health every day. This matters because most people leave the office thinking, I forgot my questions, or I never mentioned my diet. I want you leaving with clarity and a plan. Comment below. What usually stops you? Fear of being judged or just not knowing what to ask? And stick with me to the end because I'll give you a word-for-word sentence you can say to your doctor that introduces your low-carb, keto, carnivore lifestyle in a calm, respectful way that lowers their anxiety instead of raising their blood pressure. Here's the big idea. Your doctor visit is not a courtroom. It's a strategy meeting. When you show up prepared, your way of eating becomes a part of the treatment plan, not something you hide. Inside that short visit, your doctor is trying to prevent the big stuff: stroke, heart attack, kidney failure, diabetic complications. Their computer is flashing guideline alerts written for people on the standard American diet. If you don't clearly say, I don't eat that way anymore, they'll assume you still do and treat you like everyone else. Meanwhile, you're actually changing the root causes. Lower insulin, less inflammation, more stable blood sugar with low-carb, keto, or carnivore. The system is an autopilot, but your metabolism is not. Your job is to calmly update the file. Here's how I eat, here's how I feel, and here's what we're measuring. Quick myth to bust. The myth is, if you tell your doctor I'm keto or carnivore, they'll explode, so I just keep quiet. The reality is most clinicians are worried about safety, cholesterol, kidneys, muscle, not about controlling your plate. When you bring real data instead of just opinions, the conversation changes. Let's build your one-page checklist. Picture 4 boxes on a single sheet you bring to every appointment. Box 1, labs to ask for. You can say, Doctor, because I'm low-carb, keto, carnivore, I like to follow a few extra markers, if you think they're appropriate. Then ask, can you check fasting insulin and A1C, not just a random glucose? Can you follow a full lipid panel including triglycerides and HDL? And if possible, an ApoB or an advanced LDL lipid panel looking for LDL particles. And because this way of eating can change kidney and liver numbers, can we follow kidney function and liver enzymes? And consider a cystatin C, which may be a more accurate kidney test with my dietary pattern. Box 2, medications and side effects. Before the visit, list every med and supplement, especially blood pressure meds, diabetes meds, and GLP-1s. In the room, say, since I'm going low-carb, keto, or carnivore, my sugars and blood pressure have changed. Can we review my meds so I don't get low sugars, dizziness, or other side effects? As your metabolic health improves, your prescriptions often need to change too. Box 3. Weight loss and metabolic goals. Instead of, I just want to lose weight, say, my goals for the next 6 to 12 months are to lose about X pounds of fat, improve my energy, and if it's safe, reduce some meds. Can we decide what we'll track? Maybe the waist size, A1C, blood pressure, or labs, so we can know if the plan is working. Now it's you and your doctor versus the problem, not you versus your doctor. Box 4, how to say I eat differently without starting a fight. Here's the sentence I promised. Doctor, I've chosen a low-carb, keto, or carnivore way of eating that focuses on real food, meat, eggs, and some non-starchy vegetables, and healthy fats to improve my metabolic health. I'm not asking you to agree with every detail, but I'd really value your help making sure I'm doing it safely. That one line says, I'm serious, I'm informed, and I want you on my team. Quick pause. If this is helpful so far, tap that like button so YouTube shows this to more people trying to talk to their doctor about low-carb, keto, or carnivore without feeling judged. And if you're new here, subscribe so you don't miss future videos that help you protect your nest and achieve metabolic health. Now, a couple of common landmines. Landmine 1. My doctor said keto will wreck my kidneys. You can respond, I understand the concern. My understanding is that in people with normal kidney function, more protein is usually okay. But it's different if you already have kidney disease. Can we look at my kidney labs together and decide what's right for me? Landmine 2. My LDL went up. My doctor freaked out. You can say, since changing my diet, my LDL changed, but my triglycerides dropped and my HDL improved. Can we look at the whole pattern? Maybe check ApoB or other risk markers like LDL particle sizes to determine if the quality of my LDL particles are favorable or not, and then decide on a plan. If your doctor jokes about bacon, smile and pivot back to data. I get that it sounds extreme compared to usual food pyramids, but here's how I feel and here are my numbers. How do we keep improving these together? Here's a lesser known move that can change the tone of the whole visit. Ask for trends instead of labels. Say, instead of deciding today if low carb or carnivore is good or bad, could we follow my labs, blood pressure, weight, and symptoms over the next 3 to 6 months and adjust based on my results? That turns your care plan into a shared experiment, and good clinicians respect results more than opinions. Now, let's rebuild that one-page 2026 checklist so you can literally copy it. At the top, I am following a low-carb, keto, or carnivore way of eating focused on real whole foods. Then 4 short sections. Labs I'd like to track if appropriate, fasting insulin, A1C, full lipid panel, maybe ApoB and LDL particles, kidney and liver markers, and possibly a cystatin C. Meds and side effects. List everything plus the question. Do any dosages need to change with my new way of eating? Goals: fat loss, energy, metabolic health, and what you and your doctor agree to measure. Bridge sentence. I'm not asking you to agree with every detail, but please help me do this safely. That's your script. Print it, bring it, hand it over. Let the paper remember what your nerves might forget. In about 20 seconds, here's your recap. Number 1, your low-carb, keto, or carnivore lifestyle is a strategy to fix root causes like insulin and inflammation, not a fad that you have to hide. Number 2, a 15-minute visit